Hi, I'm Mike Lawless, Senior Principal Scientist at Simulations Plus. Thank you for attending the AIDD Plus conference and for watching this video. The title of my presentation is Using 3D Shape Matching in AIDD to Design CCR4 Antagonists. This slide is an overview of the presentation. In the first section, I'll discuss 3D virtual screening, which is new functionality that will be released in ADMET Predictor 10.5. Then I'll give an overview of the AI-driven drug discovery workflow. Next, I'll talk about CC chemokine receptor 4 background and known CCR4 antagonists. In the final section, I'll present results of AIDD runs that identify novel potential CCR4 antagonists. In ADMET Predictor 10.4, we introduced functionality to generate 3D structures from 2D structures, both within the graphical user interface and from the command line. Several options are provided, including single versus multiple conformers, minimization based on the MMF94S force field, and constrained coordinate generation using user-defined templates. We continue to enhance this functionality by introducing 3D virtual screening in ADMET Predictor 10.5 that will be released later this year. The first step in the process is to create a 3D conformer database containing the compounds of interest. Next, one defines a query structure or a reference structure. And the geometry of the reference structure can come from an X-ray crystal structure or can be generated theoretically, as I previously described in ADMET Predictor 10.4. The searching algorithm can run on a GPU for increased performance. The similarity score consists of shape-based term that is based on the overlap volume and a feature based on alignment of pharmacophore features such as hydrogen bond acceptors and donors, positive and negative groups, and ring centroids. Overlap volumes are computed using atom-centered Gaussian functions that are convenient for gradient-based optimization. This slide shows ROC curves of our performance on the Directory of Useful Decoys, or DUDS dataset. A sample of ROC curves is displayed. Here we use a feature weight of 10. The upper left-hand corner shows a nice ROC curve where DHFR active compounds have high scores compared to the decoys. Here, the AUC is 0.99. The lowest AUC obtained is for the CDK2 dataset, where the AUC is 0.56. The average for all 40 targets in the DUD dataset was 0.78. On this next slide, I'll describe the AIDD workflow. The AIDD workflow begins with construction of a knowledge base. This knowledge base can contain protein structures, ligand 2D or 3D structures, any SAR information that's been gleaned from the data set, and QSAR models. And these knowledge base will be used as objective functions within the AIDD workflow. For example, the candidate compounds could be docked into the protein structure, or they could be overlaid on the 3D structure of the reference molecule. And of course, you could use QSAR models to predict the activity of the compounds. And you could also use QSAR models for off-target effects in which you'd want low activity. The process starts out with selection of a seed molecule. Typically, this would come from the knowledge base. From there, we generate candidates. Candidates are generated by applying Smirk's transformations to randomly selected compounds from the current population. Each candidate that's generated must abide by the SAR requirements and must not match non-drug-like fragments. Once the population is created, it is scored. And this could be from a QSAR model to predict the activity, docking. We can also use synthetic feasibility, ADMET properties, pharmacokinetic properties, and of course 3D shaping matching, which is the subject of this presentation. Next, a Pareto selection is performed on the population to select the best molecules to move into the next iteration. Then this iterates over and over again. In the next sections of this presentation, I'll give background information on CCR4 and CCR4 antagonists. This information will be incorporated into the knowledge base that will be used in AIDD to create potential CCR4 antagonists. CCR4 is a G-coupled protein receptor. It is expressed in T helper 2 cells that produce interleukins. GPCRs contain a 7-helix region that spans the cell membrane. G proteins are attached to the receptor on the intracellular side of the protein. There are 2 native ligands, one called CCL17, also known as TARC, and CCL22, also known as MDCK, that bind to the receptor. When these ligands bind to the receptor, it causes a conformational change in the receptor that allows GDP to be exchanged for GTP on the G protein. The G alpha subunit then dissociates from the other 2 proteins and interacts with other intercellular signaling proteins. GTP is eventually converted back to GDP to form the resting state of the GPCR. The known CCR4 antagonists bind to 2 allosteric sites on the protein. One of the sites is intracellular. This slide shows known CCR4 antagonists, the company that discovered them, a measure of their activity, and the publication where the data was extracted. Some of the ligands have been postulated to bind at site 1 of the 2 sites. 4 of the compounds contain a pyrimidine ring, which is either by itself or fused to either a pyridine ring or a phenyl ring. All of the compounds contain a hydrophobic phenyl ring with 1 or 2 chlorines attached. The compounds also contain a protonatable amine. The GSK compound contains 2 protonatable amines. The one highlighted has the higher pKa. This slide shows known CCR4 antagonists that bind to site 2. The compounds also contain a hydrophobic phenyl or thiophene or naphthalene ring in this case with chlorines attached. All of the compounds also contain a sulfonamide group. The sulfonamides that contain a hydrogen atom are also predicted to be acidic at pH 7.4. The highest predicted pKa is 6.91 for the sulfonamide nitrogen in the indazole compounds from GSK. This slide shows a couple of molecules from RAP Therapeutics that are currently in clinical trials. The GSK indazole was the only CCR4 antagonist, to my knowledge, that was used in a clinical trial. The compound on the left is similar to the pyrimidine-containing compounds that I showed a couple of slides ago, and it also contains a protonatable amine. The compound on the right contains the pyrazolopyrimidine, similar to the compound from RAP Therapeutics that I showed on a few slides ago. The one on the left has completed phase 1b trial for patients with atopic dermatitis, and this one on the right is used in a cancer clinical trial. I would expect both of these compounds to bind to site 1 on CCR4. Before we move on to the AIDD runs, let's take a step back and look at CCR4 S1 antagonists in 3D and how these compounds overlay onto the RAF therapeutic compound that will be used as the reference structure in our AIDD runs. This will give us a feel for the Tanimoto range from 3D shape matching with respect to known CCR4 antagonists. The RAF therapeutic compound will be used as a reference or query structure to search a conformer database of these 4 molecules. Note that one could use the coordinates from a co-crystal structure as the reference geometry. However, to my knowledge, there are no CCR4 3D protein crystal structures. First, we'll generate 100 conformers by incrementing the rotatable bonds, but each conformer must meet the following criteria. A 0.25 minimum RMSD between the conformer pairs. So this will compare each conformer to another, and if the RMSD is less than 0.25, it will eliminate one of those conformers. And this helps generate a diverse structural or conformer database. Next, each conformer must be within 10 kcals per mole of the minimum energy structure. Then we'll take the minimum energy structure and minimize it to generate the reference conformer, because we only want one conformer for the reference structure. Next, we'll generate a conformer database, our candidate database in the same way we did up above, except all 101 conformers will be stored. Then the algorithm will take each conformer of each compound, overlay it on top of the reference structure, and then output the conformer with the highest Tanimoto score. Now let's take a look at the 3D structure of the reference conformers and how that single structure was generated. So I generated all 101 conformations of the RAP therapeutic compound, and then I overlaid them onto the pyrazole-pyrazine structure so that you can see, keep this fixed, and then you can see how the substituents rotate around that group. So here we have the phenyl group with the methyl group, and then the phenyl with the two chlorines. Then over on the left-hand side, we have this 6-membered alkyl ring with a double bond in it. And then we have the 5-membered ring, alkyl ring, and then the hydroxyl group off of that 5-membered ring. Then I can highlight the lowest energy conformer, which will be this C1 conformer up here. And you see that highlighted in yellow here. So it's kind of in the middle of the pack. And then we can undisplay all of the compounds except for the reference structure. So here's the geometry of the reference structure. And note that it has a number of features. So each ring will be a feature, hydrogen bond donors, acceptors, etc. And those will be weighted by 10 relative to the shape. Now let's look at the overlay to the wrapped therapeutic compound that I've highlighted in yellow. First, we'll focus on the phenyl ring in the upper right-hand corner. You see that 3 out of the 4 candidate compounds, the phenyl ring overlaps very nicely, whereas this 4th one, it's a little bit off. If we take a look at the structures that overlay well, we see that there is a 2-atom spacer between the pyrimidine ring and the phenyl ring. So the nitrogen and then a methylene group between there. Those compounds overlay very nicely onto the wrapped phenyl ring, whereas the compound that doesn't only has a 1-atom spacer between the phenyl ring and the quinazoline ring. Now let's focus on the left-hand side chain of these molecules and just compare them one at a time. So if we compare this first molecule's overlay, we see that the spiral group here, the nitrogen, overlays very nicely onto the protonatable amine of the wrapped compound. Now, I mentioned earlier that this has a higher pKa, but this could also be protonated also. And the side chain just doesn't match up on this pyrrolidine side chain quite as well. Next, if we look at the second molecule here, now this is the one where the phenyl ring doesn't overlap as well, but you can see that this side chain has a very nice overlap. So this compound on the candidate compound is a pyrimidine and a pyrrolidine ring, and that overlays very nicely onto the protonatable amine of the wrapped compound. Again, this third structure has a very nice overlay onto the wrapped compound side chain and puts the protonatable amine right on top of the protonatable amine of the wrapped compound. Now here, this side chain is fairly flexible. See, it's just an alkyl chain out here. Now, if we look at the final compound, the overlay is not quite as good. So this has a pyrimidine ring here where this would be the protonatable amine, and it's about 1 bond away from the wrapped compound's protonatable amine. All 4 of these compounds' Tanimoto score, it varies between 0.45 and 0.49. So it's a little bit lower than you would expect for Tanimoto similarity to structures that are antagonists of the same protein. But because the reference structure has a large number of features, and those are weighted heavily, that kind of reduces the score. And then what we'll do in the AIDD runs is try and come up with compounds that have higher scores than these. In the final section, I'll present AIDD results that use shape matching to generate molecules where the pyrazole-pyrazine ring system in the wrapped compound is replaced. In the first run, bicyclic rings are generated. In the second run, one of the ring systems identified in the first cycle is held fixed, and the side chains are optimized to produce better overlays onto the wrapped compound. This slide shows the AIDD setup. Here we just defined a simple seed molecule, a 1,7 disubstituted naphthalene ring, shown here on the right. We had three objective functions to optimize: synthetic difficulty, fraction absorbed, and Tanimoto from the shape matching algorithm. So this was implemented as an external application within AIDD. We specified a query molecule that would match the RAF pharmacophore. So here we specified an aromatic ring with a one-atom linker to an aromatic ring. So this is the upper right-hand portion of the RAF compound. And then we had an aromatic atom connected to an aromatic atom that could either be a 5 or 6 membered ring. So both of these fusion points here could either be a 5 or 6 membered ring. And then another aromatic atom, an aromatic atom, and then the alkyl ring over to the right. And I've highlighted here in red the match onto the RAP therapeutic compound from this query, from this SMARTS query. Then we used a drug-like filter. We added a few more limitations and made sure that we didn't match the RAP compound. We performed 10 generations. Each generation, except for the initial one, generated 500 candidate compounds, whereas the initial generation, or initial iteration within AIDD, we used 1,000 generations. So the overall population would be 5,500 compounds. This takes about 15 minutes on my Dell laptop computer with an Intel Core, and then I used the option within the shape matching to use the NVIDIA graphics card. This slide shows the scaffolds that were produced from the AIDD run. 108 compounds with 10 scaffolds were produced. The scaffolds are composed of 5,6 and 6,6 fused ring systems that should overlay nicely onto the RAF therapeutic compound reference structure. Now let's examine the overlay of these molecules that was produced by the shape matching algorithm. I've displayed all 10 compounds produced by AIDD and the RAP compound that is shown in yellow. The benzyl groups of all the molecules overlay onto the RAP dichlorophenyl group. I'll undisplay all the compounds except for the RAP compound and then view a few of these examples one at a time. The first molecule here contains a 6,6 fused ring system that is called a 1,6 naphthyluridine. We have the benzyl group in the 5 position of the ring, and then in the 3 position of the fused ring system we have piperidine ring. This piperidine ring shows up in 9 of the 10 examples that I've displayed here. I'll use this scaffold in a second round of AIDD. The next example shows a fused 5,6 membered ring, a pyrrolopyrazine, that only differs from the RAF scaffold by 1 nitrogen. This produces an exact overlay of the ring systems. Again, we see a piperidine overlaying with the 6-membered ring of the wrapped compound. In the third example, we have an amide group attached to the piperidine ring, and this extends towards the pyrrolidine of the wrapped compound, and the nitrogens overlay perfectly. Thus, if we would substitute an amine, so maybe remove this carbonyl or replace it with a methyl group, then this would become protonatable and would overlay on the protonatable amine of the wrapped compound. And then finally, in this fourth example, we have a morpholine ring. And of course, you can't extend in the 4 position of the piperidine ring. In a second AIDD run, I used a 1,6 naphthyluridine seed molecule and specified this scaffold in the scaffold query. Thus, I'm optimizing the side chains. This next slide shows the 10 best scoring ligands. All compounds contain a protonatable amine that I've highlighted in blue. Most of the compounds also contain a hydrophobic phenyl ring that also contains fluoro, chloro, and bromo substitutions that are highlighted in brown. The highest scoring ligand is shown in the upper left-hand corner and has a score of 0.732. This next slide shows the 3D overlay of the compounds onto the wrapped compound. The AIDD compounds overlap most of the wrapped compound. The only missing part is the hydroxyl group. The next two slides show references used in this presentation. In conclusion, I presented our new 3D shape matching tool and its use as an objective function in our AI-driven drug design workflow. I also discussed the chemokine 4 receptor and known CCR4 antagonists. In the final section, I discussed the use of 3D shape matching in AIDD to generate potential CCR4 antagonists. I want to thank the members of our cheminformatics team here at Simulations Plus. And then finally, I also want to thank you for watching this video. And if you have any questions, you can email me at michael.lawless@simulationsplus.com. Thank you very much.